Welcome to Amazing Grays. This show is dedicated to the idea that active, informed older adults are an essential part of today's society. We provide information regarding senior issues and concerns and salute individuals or groups who demonstrate that productivity doesn't end at retirement.
And welcome to another segment of Amazing Grays. I'm Jo Johnson, and I am so thrilled to have with me Dr. Stephanie Coursen and Dr. Kurt Bannister from the Neck and Back Center. Welcome, both of you.
Thank you, Jo.
Yeah, very good to see you. I want to start off with Dr. Stephanie. Can you tell me about leg pain in a senior citizen?
Sure. Oftentimes we have patients that present in our office with leg pain. It can vary in the area that they feel it in. When they come in with pain in the back of the leg, it can be the thigh, the back of the calf, or even into the foot, or all areas at one time. That tells us that it's most likely coming from the lower back area around the waist. So what we typically start out with is an exam, and from there we'll take x-rays if necessary. On x-ray we typically see that there are misalignments in this area around the waist, and also sometimes the spinal column is too close together. When that occurs, oftentimes the nerve is pressed upon, and we need to remove whatever is pressing upon that. So typically when a patient has vertebrae that are too close together, we'll put them on a traction table and start some very gentle traction to open up these spaces where the discs lay and where the nerves come out. And that's very effective in removing the leg pain. We also see leg pain into the front too. Now that is a different area of the lower back because each level of the lower back nerves come out and go to the legs. This area is usually about 5 inches above the waist. So on x-ray, we'll typically see vertebrae that are too close together in there. And again, we do the same thing. We'll often traction to open up the holes where the nerves come out and helps to alleviate the pain and cramping that patients feel in their legs. If there are misalignments, we also do adjustments on the legs to help to realign the spine to alleviate some of this nerve pressure.
Now, if they have leg pain, do they normally have back pain also?
That's a good question. Actually, it's almost 50-50. That's why a lot of patients come in are kind of confused. They're like, I have pain in my leg, what's going on? They think they have a leg problem. And usually on their history, we'll find some kind of history of low back problems. And that's when we take the x-rays, we can actually see that there is problem in the spine. But you don't have to have low back pain. There's a chance that you will have low back pain at the same time that you have the leg pain, but you don't always have them occurring at the same time.
Oh, okay.
Yeah.
Interesting. Dr. Bannister, can you tell me what exercises can a senior do to help themselves?
I see in the nursing homes a lot of the exercises very minimal, unfortunately. Basically, I think that you should do as much as you can do as long as you can do it. Weight-bearing exercise is extremely important for the ladies. You get into your 50s, 60s, 70s, 80s, squats are a very good exercise. Strengthens the large upper thigh bones and the spine, and can prevent osteoporosis. What I found is if a person doesn't exercise, they get the osteoporosis, they can actually incur spontaneous fractures in the back, not really even know that there's fracturing going on. But as the years go on, the bones collapse and they start hurting and they really don't know why. So exercise is extremely important. I would stress that the seniors should try to get out and, again, do as much as they can, keep their busy with their hobbies, and keep their spine healthy. Chiropractic actually forms as it serves as a form of constructive exercise to the spine. It not only aligns, but it flexes the spine. That's why chiropractic is so important.
So what you're saying is basically some types of treatment would help a senior citizen in general? I mean, just on a normal basis?
Yeah, everyone thinks of chiropractic, I'm sure, a bone out of alignment, put it back in.
Right.
But it's much, much more than that. You can flex the spine gently, okay, and there's techniques to do this. Feels good to the seniors. Feels
Okay,
good.
it doesn't hurt?
No.
I mean, this is a procedure that is light and
People
easy?
enjoy coming in. It's nothing that you dread. It's not like going to the dentist or something like. No, it's a very pleasant thing. They lay on the table to get their spine aligned and flexed, and it serves as exercise to the spine. It's important to keep all these discs and vertebrae moving freely. It's extremely important.
So you're a strong advocate of exercise?
Absolutely.
No matter what type of exercise it is?
As much as you can do. And
as often as you can do it?
I would stress, don't give up those hobbies like bowling or gardening or whatever it may be. Even if you hurt a little bit, it's important to keep going.
Very good. Dr. Stephanie, can you tell me about leg pain? I mean, not leg pain, foot pain.
Sure. A lot of patients come in after they've exhausted all the other avenues with foot pain. Typically, the most common route taken with foot pain is our cortisone or steroid injections. And they're very painful, according to my patients that get them into the foot. And I'd say almost all of my patients who have received these injections are dissatisfied with the outcome. They're painful, but they don't feel any relief of the pain. So what I do is typically have them lay on the traction table again, and I'll evaluate their foot to see if there are any misalignments of the bones. There are many little bones in the foot, and I'll adjust the bones if necessary, if they're out of alignment. But even more important, I think, with this foot pain is the muscle that runs along the bottom. It's called the plantar fascia, and commonly known as plantar fasciitis is the pain that you feel. So typically I will do some very deep trigger point therapy, and it might be a little tender as I'm doing it, but I have so many good results with this. My patients always report that this was much more satisfying, the outcome, compared to these injections, and they're amazed at having to suffer for so many years with the pain, and with just a few treatments of the plantar fascia, they feel a lot of relief.
I know that the plantar fasciitis I have experienced, and it is tough.
It is.
They had me rolling on frozen pop bottles and tennis balls and all types of things, and it took forever to go away, but it was very painful.
It is. It's very painful.
One other thing before we close out I'd like to talk about is what advice can you give a senior citizen, those that are like in their 70s, their prime years? What type of things can you tell me about their spinal cord?
Again, I think it's very important to stay busy, to get your regular chiropractic care. They found, there was actually a recent study done that they found that people tend to stay out of nursing homes and those type of facilities when they utilize chiropractic care. It was a very, very high percentage of chiropractic people, quote unquote, stay out of the nursing homes ultimately.
I do want to thank you both for coming. It has really been a treat, and maybe we can do this again sometime.
Sounds good.
Thank you.
Thank you very much.
Oh,
Thanks for having us.